And we welcome you back to our program. Good to have you staying with us on the show today, and some very important health information coming our way. Dr. Hirose is back with us today. Welcome back to the show. Good to have you here.
Thank you. Good morning.
Good morning. We've been talking a little bit in the past about your background and your training, education. In addition to learning about medicine, you also teach. You've done some teaching at UCLA. Some of the future doctors are getting some of your expertise up there as well. And you're really become an expert in the field of, our blood, and specifically handling it, dealing with it, testing it, and doing some great testing for our residents here in the community. We talked about a little bit of your background last time. Let's get more specific. And I'm sure all your patients are different, but say someone comes to you for the first time, what's a typical experience for a new patient at your clinic?
A patient usually comes for just a few indications that involve bleeding and clotting. And the most common would be a patient that has an abnormal heartbeat, and in that heartbeat there's a possibility of forming a clot. And so the patient is placed on a blood thinner to prevent the clot from forming inside the heart, and thus stop the chance of a stroke. So the patient will come to the clinic, and I and my staff would take a very complete history and physical to find out what are the other things that may contribute to heart attack, stroke, or any other bleeding or clotting event. After we have that information, we have a better database with which to adjust or recommend the standard amount of blood thinner. We use a medication called warfarin, which is one of the top 10 of the prescribed medications. Its trade name is Coumadin, and it is a drug that actually inhibits vitamin K, and vitamin K is in the food that we eat. The other interesting part of this is that the body also makes vitamin K, but indirectly. It's the bacteria in the colon and then the small intestine that makes vitamin K. So our approach to adjusting Coumadin or warfarin has to take in both those into account. What is the diet, and what are the things that can affect the bacteria in the colon, such as antibiotics.
Right. So somebody could be eating the wrong kinds of food, internally generating more vitamin K, which is offsetting the good things being done by the medication.
Absolutely, and the classic challenge is if you're on a liquid diet such as Ensure, ProBalance, or Boost that has lots and lots of vitamin K, have to make sure that we balance that out with the amount of medication.
All right, very good. And of course, that's kind of what it's all about. Unlike a lot of medications where maybe a blood test, once a quarter or even once a month is sufficient, with Coumadin you have to do a lot more testing, I understand,
yes,
to keep those levels at a safe level. A lot of us are concerned, and we're hearing so much today in Washington about all the cost of medical care and the various proposals being made in Washington, and a lot of discussion about the insurance industry. Yes. Insurance plans, any of those cover what you do?
Yes, all the insurance plans cover coverage for prescribing, monitoring, and maintaining response to Coumadin. Since it's such a highly prescribed medication, I think it's appropriate that the resources are being allocated so that it's done correctly. And unfortunately, since it is a blood thinner, the adverse effects are either clotting or bleeding, so stroke or bleeding. And unfortunately, if it's not managed correctly, it's actually in the top 10 of adverse drug reactions. So we take the management very seriously and tailor it to the patient so that it's not only a safe medication to use, but also it's not a huge impact on lifestyle.
Right, and obviously the insurance companies recognize the importance of that, and you're able to help with the paperwork on all that as well. Obviously, most of the patients that come to you would be either referred by their family doctor, an internist, or a cardiologist probably. When you get the results back of that test, does that get sent to those doctors automatically?
It does. We have a good working relationship with the referring physicians. It falls in two groups. One where the physicians would like a complete record, and so we send a copy of the laboratory result and what we do. Another is that in some sense medicine has become a little bit compartmentalized, and many of the referring physicians want us to completely manage that piece of the patient's care. So we then just maintain the records for that drug treatment.
Right. So they'll have recommended the Coumadin, but they're going to let you manage the dosage and the testing.
That's correct.
Okay.
And that's what's very nice. The patient will come in, and within a very few minutes, we know the value, we know what's going on immediately, and we know how to adjust it so they know before they leave.
I think most of us are used to getting a blood test either in the doctor's office, at a laboratory, or in the hospital, and results can take, well, if it's in the doctor's office or at a lab down the street from the doctor's office, sometimes a couple of weeks before you, as the patient, know.
Yes.
I understand yours is a lot faster.
Yes, and we use a point-of-care device, and we believe that capturing the moment and knowing what the dose adjustment is the most important before the patient leaves, so that there's no people falling through the cracks or any misunderstandings.
I understand there's some patients actually do a self-test at home.
Yes.
Risks involved in that?
Yes, the government insurances actually cover home monitoring, and I think that for a portion of the population that's a very good option.
Is it?
It requires some knowledge, some skill base with a small instrument. The difficulties that are encountered is that it is a laboratory test that requires that you take a blood sample from your finger. That means that you have to be diligent and on a schedule to make sure that that's completed. And then the interpretation of the results, that is carried to a physician for interpretation. So the current state is, unlike glucose, the Coumadin monitoring, you still need to contact a physician to make sure that there's an appropriate adjustment. But for certain patients, I think that that's a very good option as well.
I know patients with diabetes often are finding themselves self-testing, and so
Yes.
it's not undoable, but a little more chemistry perhaps involved in Coumadin testing.
It is, and the insulin dosing, by and large, is a little bit more stable, so the not as much challenges as we see with Coumadin testing.
All right. People have questions or want to find out more information, they can call your office or get their doctor to refer them?
Yes.
All right, very good. We have a new phone number that we'd like to give that is going to give the folks a chance to contact you. 487-2624 is the number there. And again, they can get more information, find out about referrals. And I know you and your staff are really specializing in this important area of our blood and all the interrelationships of it. So you're well trained, and your staff as well.
They are.
Doctor, we thank you for sharing some time with us. See you back here in a few weeks with more on our blood and how you can make sure all your levels are where they should be. We'll be coming back with more right after this.
I had 2 open heart surgeries when I was 29 years old. I was told that I was going to have to take Coumadin for the rest of my life. For 15 years, my ProTime went unregulated.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks.
At the Coumadin clinic, I get my blood drawn right away, I get the results right away, and I'm seen by a real doctor. Since I've been regulated, I've been able to do my gardening, my stained glass, and I ride horses.
Laguna Hills Coumadin Clinic is located on the Village Bus Route.